Over the past few years, psychiatric emergencies have increased the volume in all ERs nationwide. The emergency department acts as the safety net for everything.
Anybody that's placed on an involuntary hold are brought directly to an emergency department. There was what was called a psychiatric emergency department. The paramedics would take them directly to the psychiatric emergency rooms. What happened was those were closed down, so a lot of those services stopped. And when that happened, those patients got redirected to emergency departments. We realized that was going to happen here in our counties. We needed to figure out what we could do different.
We were acutely aware that it took sometimes days to find a psychiatric hospital bed for someone in need. We came together and developed a solution.
Teresa Heyer and Tony Hobson really came together and formed a good collaboration and a plan to try to take care of these patients in a different manner.
We're the only bi-county behavioral health department in the state.
So the difference here that's so unique is that, first of all, we have county workers that deal with mental health patients here in our emergency room 24 hours a day.
As soon as the person arrives at the emergency department, our staff is there ready to start the process.
We treat them as a true emergency. So just like we take care of a trauma patient or a heart attack, where we have all hands on deck, that's how we treat our psychiatric patients.
Along with that, we have CEP telepsychiatry services who have a psychiatrist on 24 hours a day doing full behavioral assessments.
We have the telepsychiatry on board so that we can get the medications and the treatment started right away.
It is a collaborative effort. We work in unison and we all rely on one another to get our job done.
Statistically, 75% of the patients, once they get to the psychiatric hospital, are discharged within 23 hours. What we're doing here in our emergency room is we're doing it on the first hour that they come in.
We learned that the work that we do is really timely. We have to come to disposition and know what we're doing with the client almost immediately when they come in the door.
It's safer, it's more efficient, and the patients are getting the care they need.
Over 50% of our patients get a safe discharge plan, all done by our county workers here, and they get the follow-up in the community, so they're able to go home. They don't have to go to that very coveted inpatient psychiatric bed. They're getting all the safety plans, they're getting follow-up and the community resources. If every emergency room in California did the same exact thing, we wouldn't have near the crisis we have right now for our psychiatric inpatient beds and the lack thereof, because only patients that truly need them would be there.
Somebody who would wait days for a psychiatric hospital bed, they're in there within 12 to 15 hours on average.
Because the treatment is started and because we are doing the interventions simultaneously, we can often avoid a hospitalization also.
I truly believe this can be replicated at other organizations. It would change the entire face of the behavioral health system and the ability to care for the patients.
We want to do something better. We want to do something that really works better than anything that has ever been tried before.
We set out to solve a problem, and I think we effectively have, for our community. And it feels wonderful because I know that people are getting the care that they deserve.